My name is Michelle Morisi, for those of you who don't know me. I'm a licensed acupuncturist and practitioner of Chinese medicine, and I'm based out of the Greater Providence area. And if you'd like to look up where I practice and where I offer Qigong classes, you can go to my website there, acupuncturebymichelle.com. And if you have any questions or you want this slide deck emailed to you after the class, feel free to reach out to me at that email address. And let's get started. So if you didn't see part one, you can go back and look in Wu Healing Group or on YouTube. It's now posted to YouTube, the Wu Healing channel. So just to review a little bit about the first class, part one of tongue diagnosis, the things that we see in a healthy tongue. First of all, the qualities that we look at on the tongue is pretty much everything you can think of. We look at the color of the tongue, the shape, the level of moisture or lack thereof, the texture of the tongue, the coating, or also translated as fur or moss on the tongue, and the veins underneath the tongue, and lastly, the movement of the tongue or lack thereof. So a healthy tongue will typically be pink in color with a smooth shape and texture, a nice rounded tip, and a proportionate thickness to the person's body. So neither too thick or too thin. A decent level of moisture, so not very wet, not dry, and smooth as opposed to cracked. So a lot of people tend to develop like a midline crack, a fissure down the middle of the tongue, or smaller fissures on the body of the tongue. And then the veins underneath the tongue are typically, you can sort of see the shape of them, but the color blends in with the tongue color in a healthy tongue, so they're pretty thin and kind of pink appearing. And lastly, the movement of the tongue, it's lively, it's not flaccid, it's not limp, nor is it trembling a lot, just kind of the average movements of the tongue. So that's the tongue in health. Typically you can look at a baby to see a nice healthy pink tongue. And I think I skipped over the coating. The thin white coating is the healthy version of the tongue coat. So it's kind of easier to learn about coatings when you see them in a state of imbalance. A thin white coat you just don't even think about because it just looks normal. So we'll get into kind of what a coating that's thicker or that has a different color to it looks like, and also what a tongue without a coating looks like. So that might help us understand the thin white coat better. But this little baby here is a good example of a pink tongue with a thin white coat. You can see there's some moisture on the tongue. It looks like she's holding her tongue in a way that the tip looks a little narrower than I think it really is, but you can see the very tip is nice and round, no cracks or anything on the tongue, no teeth marks along the edges, which we call scalloping typically in Chinese medicine. So moving along, this is a review of the map of the tongue based on the organs associated with each area. So just to review, the tip of the tongue is associated with the upper jowl or upper body, so the heart at the very tip, the lung behind that, and then the middle of the tongue is associated with the middle jowl, so the digestive organs, the organs kind of in the upper abdomen, spleen, stomach, liver and gallbladder. Typically, I don't really hear people talk about the gallbladder with the tongue. It's more so the liver, and in general, more so the yin organs we talk about. And for more about the yin organs, you can look at my Intro to Pulse videos, which are also on Wu Healing YouTube page. So the liver mainly is what we associate with the sides of the tongue, and the spleen on the inside of that, and then at the very center, the stomach. And the lower jowl at the back of the tongue, which can be kind of hard to see sometimes. So I always I'm sure to tell people to open their mouths as wide as they comfortably can and let their tongues hang out as far as they can so that we can see that lower jowl better. That lower jowl area, which is mainly, we're focused on the kidney with that area, the health of the kidneys. And so we will get into the different qualities and what they signify, what patterns of disharmony they signify in Chinese medicine. And for more on what those patterns mean, again, you can go to my Intro to Pulse video, to those videos for a little more about that and for more resources on where you can learn more. So a pale tongue typically indicates blood deficiency. It can also indicate qi deficiency, but definitely some kind of deficiency. And red tongue indicates heat, some kind of heat, whether it's what we call empty heat or full heat in Chinese medicine. That depends on the other qualities of the tongue, but red in Chinese medicine always means heat. Red skin, redness in the eyes, and red tongue. And then dusky is indicative of what's called qi stagnation. So when the qi is not flowing appropriately, it's this kind of bluish tinge to the tongue, and you might see, like, you're always going to see combinations of qualities, right? We don't exist, these qualities don't exist in a vacuum, so you might see like a pale dusky tongue, for example, and so we know that there's an underlying deficiency of blood and or qi leading to a stagnation of the flow of qi. And so this might manifest with signs of frustration or like kind of a trapped emotion, pent up emotion, maybe even depression, and maybe discomfort in the body, achiness, but not the severe pain of blood stagnation. And peachy, the peachy color, it's more of like an orangey shade. This is also indicative of blood deficiency, but it's usually seen on the sides of the tongue, in the liver areas, or the underside of the tongue. So it might be specifically indicating a liver blood deficiency. So there can be in Chinese medicine blood deficiency, maybe more so associated with one organ than another. And you can distinguish based on the tongue, the pulse, as well as the symptoms that the patient might describe. And lastly, a purple tongue, which is indicative of blood stagnation. So the blood has stopped moving in a certain area, This could be manifest as a sharp pain that's located in a specific area. That's usually the number one sign of blood stagnation. Um, and it can manifest as a literal blood clot, but it doesn't necessarily mean something that severe. But yeah, that darker, this is going to be much darker than the dusky color, this purple. So those are the different major colors that we might see on the tongue. So taking a look at this tongue, you can take a guess as to what color you might assign to this tongue. I'll give you a moment to think about it. So it can be harder when you haven't been looking at that many tongues, you don't have as many to compare to, but the more experience you get, the more, obviously, the easier it will become to determine. So this would be considered probably a pale tongue. So taking that in mind, sorry, there's something on this person's tongue. There's a limited amount of free tongue images out there, but you can see a good amount of this tongue. So I'll give you another moment to consider the color of this tongue. You can compare it to this last one. It can be tricky with images, lighting differs, and it's always best to look at a tongue in person in a well-lit area. But the more experience you get, the easier it will become to kind of get a sense and to look at the other signs and symptoms to get a sense of things. So this tongue is pretty pale as well. It looks a little peachy in this image, at least around the very edges and the tip. So that I would consider pale, slightly peachy tongue. And you can see a little bit of cracks, nothing too severe, but a few cracks down the midline as well. So next we'll get into the shape of the tongue. So a thin tongue that might look kind of like flat, but it just looks disproportionately thin compared to the size of the person or comparing it to other tongues. And this is indicative of blood deficiency. So not enough blood to fill the tongue, similar to the pulses. A thin pulse is also indicative of blood deficiency. Whereas a puffy or a swollen tongue is more indicative of qi deficiency, and more specifically qi deficiency that has led to dampness, and possibly even to more severe condition of yang deficiency. So depends on the other qualities of the tongue, but usually you see puffy and swollen or swollen tongues, and this, that there's a deficiency of qi, and then that deficiency of qi leads to an overaccumulation of other substances resulting in dampness. So usually it's the spleen, the stomach, that are not able to, and particularly the spleen, not able to transform and transport the qi from food appropriately. So we end up with dampness. And so you can even think about someone's body in general. Typically someone with a kind of puffy or swollen body, like kind of excess weight, maybe like a little flabbiness, their tongue will usually also look kind of puffy and swollen, and in general there's an overtaxing of the spleen and stomach in people of that constitution, leading to dampness or excess weight, excess fat, maybe excess bacteria, overgrowth of bacteria in the gut, things like that. And so puffiness is kind of the tongue is bigger vertically than is proportionate to the person and or to the person's body and health, and a swollen tongue is wider than is proportionate. And when you get a swollen tongue, you almost always end up with a scalloped tongue. So this is also called teeth marks. So the tongue is literally, it's pressed up against the teeth, and so that the teeth form kind of a mold at the edges of the tongue, so that you get this scalloping effect. And that is also a sign of qi deficiency leading to dampness. And this is very common, at least in our culture. And then a narrow tongue is indicative of yin deficiency, so a kind of a lack of substance, a lack of body fluids, and leading to a narrowing of the tongue. And it could also lead to a kind of a tapered look on the tongue, so it gets disproportionately thin towards the end, maybe even kind of pointy. And this is also indicative of yin deficiency, perhaps mainly affecting the upper jiao, so the lung and or the heart, as that is the area of the tongue that is kind of shaped that way. All right, so looking at this tongue, let me know, or let yourself know, what you think the shape of this tongue is. It can be more than one of these listed. So this would be, I would consider this to be a puffy and swollen and scalloped tongue. So not uncommon for all these to kind of go together, as there's the same underlying pattern for these. So this tongue looks a little like puffy vertically, swollen horizontally, and then some pretty severe teeth marks along the edge, or scalloping. So this is someone with spleen qi deficiency leading to dampness. And just to go back to like the color, thinking about the color of the tongue, you may have noticed it looks a little pale. And this tongue has a thin white coat, so it does look like a healthy coating on the tongue. There's a little bit of red spots on the tip of the tongue. That is could be a sign of heat, heat particularly in the heart. So you might have a tongue that's red overall, or you might have these little red spots on the tongue. Next, moisture. So pretty simple. A tongue with an average level of moisture, like we said, is healthy, but if it gets if it's looking particularly wet and it's not like right after a person has swigged water, that could be a sign, depending on the other signs of the tongue, the other qualities. It could be a sign of dampness, it could be a sign of cold, it could be yang deficiency. So it depends on the other qualities, as I said. And then dryness indicates deficient body fluids, perhaps yin deficiency, or heat, depending on the other qualities. And the texture of the tongue, really just the only imbalanced texture is cracked. So we were talking about that a little bit before, what that looks like, and that is indicative of yin deficiency. And the size and the depth of the cracks kind of indicates the severity of the yin deficiency. So it might be little creases to really big cracks in the tongue. And moving on to the tongue coating, aka fur or moss. A thick coating, no matter the color, is always indicative of disharmony, and depending on the color and the other qualities of the tongue, you can determine what exactly it's indicating, but it's always some kind of pathogenic factor. So it could be wind, it could be dampness, it could be cold. Usually I think of dampness with a thick coating. So, and the colors of the coating could be white, which indicates cold dampness. It could be yellow, which indicates damp heat or full heat. And it could be, on a more severe end of the spectrum, grayish or brown or even black looking, which, depending on the other qualities, could indicate severe cold or heat. So that will be pretty rare to see coating that looks like that. More common to see white coating or a whitish yellow or a yellow coat of varying degrees of thickness. And on the other end of the spectrum is a peeled coat, which is no coating. So it kind of just looks like a peeled grape or something, just raw. It could also be a patchy coat or geographic, which is indicative of yin deficiency as well. And this can also be hereditary, but in Chinese medicine this indicates yin deficiency. A greasy coating, kind of a, just like it looks like grease on the tongue, is indicative of dampness or phlegm. And so we'll take a look at this coating and take a moment to assess how you think that looks. So, and again, kind of hard to tell with photographs, but I would consider this to be a thick white coat, not the thickest coat, but a moderately thick coat. Could even be like a little yellowish, so indicative of a little bit of heat. But from this picture, it looks like more of a white coating to me. You might see coatings that are really just like pure white, like snow white, and that are clearly indicative of a cold damp or a yang deficiency. And how about this tongue coating? This is a pretty severe tongue. I do not often see tongues that look this raw. Definitely have seen pretty severe midline cracks and kind of almost like chunks missing out of the middle of the tongue. I've never seen it like this on the edge before, so this person has really been through some hardship to have a tongue like that. And this would be definitely a peeled, so very raw looking tongue, and obviously cracked, very cracked tongue for the texture. A lot of times pharmaceuticals can be draining to the yin, so you might see someone who's been on long-term meds or been sick a long time. It depletes our substances, our fluids, our yin. And aging just naturally depletes the yin to an extent. So not uncommon at all to see a midline crack, but this is a very severely cracked, raw tongue, very yin deficient. And also the color of the tongue, if you note, is a red tongue. So there's some heat as well for this person. And the movement of the tongue. So a tremulous tongue or a quivering tongue is usually indicative of qi deficiency. If it's shaking like a leaf in the wind, This is indicative of internal wind. I don't see that as often in people. I see a lot of tremulous tongues. It's almost like there's not enough chi to kind of keep the tongue under more control. There's a deep deficiency of the chi. If you see, on the other hand, a stiff tongue, this is also indicative, like the one that's shaking like a leaf, this is also indicative of internal wind. And in more severe cases, it deviates to the left or the right, and this is actually a sign the person is currently having a stroke, or wind stroke as it's called in Chinese medicine. So definitely get help if the person's tongue is deviating to the left or the right, and they're showing other signs of having a stroke. And lastly, taking a look under the tongue, we can notice the color and the shape of the veins under there. So kind of bluish, slightly distended or swollen looking veins is by some considered a sign of qi stagnation. So that's a more mild form of stagnation than blood stagnation. It usually manifests as, emotional, like getting stuck in different moods, frustration, depression, mild physical pain, discomfort, pain that kind of moves around, versus blood stagnation, which would be indicated by more distended and kind of darker, like purplish veins. Just like going back to the color of the tongue, purple indicates blood stagnation. Again, with the veins, purple indicates blood stagnation. And this manifests, like we were saying before, as more severe, sharp pain that you know exactly where it's located, things like that. So these veins, take a moment to assess. You can take a look at if you have a mirror or something, or you have your phone, you can look on your camera, take a look at your own sublingual veins, compare, and you can do that for all the qualities of the tongue. So these look pretty distended. I've seen darker veins than this. Again, with the photograph, it's not always the most accurate to assess, but these look pretty dark and definitely very distended. So those would be indicative of some kind of blood stagnation. It's kind of like, as I was saying in the last intro to tongue diagnosis video, it's like varicose veins under the tongue. And you can take a look more particularly, sometimes one vein is more distended than the other, like on one side versus the other. Sometimes there's certain spots that kind of bulge out more so than others. And so I'll usually ask into, if I see one side more distended than the other, ask if there's issues or pain on that side of the body, or there's been trauma to that side of the body. And if it's a specific area, perhaps it's associated with a particular organ, but don't really get into that too particularly. Just kind of look overall at the shape and the color of the veins. So that's it for part 2, and in part 3 we'll kind of put this all together to look at major patterns of disharmony on the tongue. So looking at what would a yin deficient tongue look like, what would a qi deficient tongue look like, etc. And again, my name is Michelle Morisi, licensed acupuncturist and practitioner of Chinese medicine. I practice in the Greater Providence area and teach Qigong and I'll be leading a class right after this in the group. Please feel free to reach out, and next week we'll be back with part 3, the final part of the Intro to Tongue Diagnosis. So thank you again.